Thanks everybody for joining us today. We're here to talk about summer weather health hazards in particular. We'll have speakers from the health department and emergency management along with me. I'm Sarah Dean. I work in the Central Communications Office of Multnomah County. I am the spokesperson for the health department, and I will kick it off to Abe, our senior researcher in the health department.
Good morning, everybody. My name is Abe Moland. I use he, him pronouns. I'm a senior researcher with the Healthy Homes and Communities team at Multnomah County. I'm going to talk through the first part of our presentation this morning. This is our agenda. So we'll share some recent findings on health effects of heat from last summer, some of the key takeaways from the seasonal hazard brief that is linked to at the end of this presentation. We'll spend some time talking about what are heat sensitive groups. We'll highlight other summer hazards, air quality, and drowning water safety in particular. And then we're going to review county operations in response to heat. And throughout all of that, we're going to be trying to highlight some shifts in messaging that we think are opportunities to drive action and be creative in how we reach folks to improve summer heat safety. Next slide, please. So our goal in this meeting is to try to shift the common narrative around heat regarding a couple elements. When people are at risk, because we know that it doesn't have to be that hot for people to experience heat-related illness. And we know that heat illness occurs more frequently during extended periods of heat. We want to talk about who experiences the worst effects, because folks who experience the worst heat fatalities, the worst effects of heat might be different than what folks think. And we also want to underscore that heat affects everyone. And then finally, we want to talk about some actions about what is needed to keep our community safe. We want to encourage people to do more than just check on friends and family with a text or call, and do more direct actions to support moving people to cooler locations and helping folks stay cool. We also want to note that resilience has to happen at every level, and this includes government actions to create cool neighborhoods and support community in the most extreme heat conditions. There's a role for schools, businesses, nonprofits, churches in providing programming and interventions to keep folks safe from the heat. And then also households have a role in taking action when there is hot weather forecasted. And we know that we want to acknowledge that a lot of what we're presenting today is focused on the individual household level. And we know that not every household is starting in the same place. And that's where policy, system, and environmental change comes into play to address and close these gaps. So heat resilience really takes a whole system approach, and the messages around household level awareness that we're going to be sharing today are just one piece of the larger puzzle to creating a more safe community from heat. Next slide, please. So some context around our goal. Why are we concerned about heat-related illness? We've seen increases in heat-related illness in recent years. There's a stark difference in disease burden before and after the heat dome. Over the last 9 years, 65% of heat-related illness emergency room and urgent care visits and 100% of heat-associated fatalities have occurred over the past 4 years, starting with the heat dome in 2021. So last summer, we saw 170 emergency department and urgent care visits, the second highest since 2016 behind the heat dome. Before the heat dome, it was very rare to see heat-associated death. Now some happen every year. There were 4 fatalities last summer, and it's not projected to get any cooler, so we expect this to be an ongoing public health concern. I do want to make a quick note on the language on the slide around emergency room and urgent care visits. That terminology is very specific to the data set that we use, and it represents all of the institutions that are submitting data to the Essence database. And so it represents the full patient population within the data set that we're working with. But I may shift to ED visits or visits, because emergency room and urgent care visits is very long to say. So if I do say ED visits or visits, that's what I'm talking about. So I just want to make that administrative note there. Next slide, please. So this is the National Weather Service heat risk framework, shifting to when people are at risk, part of our narrative shift goals. It's what we rely on to assess risk and inform decision making. It's also the primary environmental factor that we use for our analyses in the seasonal hazard reports. It's a forecasting tool. The National Weather Service uses this to forecast heat risk in advance so we can provide warning and prepare. And they have a great resource page where the forecast is linked. You can see 7 days out. You can see different heat risk in different areas within the county for a more local approach. And there's a lot more information on what actually is comprised, what goes into the heat risk forecast tool. To meet our goal of shifting the narrative around heat, we do want to highlight the moderate risk category. The language and descriptions around extreme and major risk are pretty clear. A lot of people see themselves as a majority of people or within the everyone category, but there's more nuance to the groups that are at risk in a moderate risk forecast. And so looking at the slide, those are heat sensitive groups, which we'll spend a lot more time talking about, especially those without cooling or hydration, those that are not acclimated to this level of heat, so coming in from out of town, and those that are exposed to heat for longer periods of time, so working outdoors or on the job. And this is not to downplay the importance of communicating risk around major and extreme risk days, but we just want to expand when folks are thinking about actions to protect their health against heat. And next slide, please. So to add some data to this, last year in 2024, while there were higher heat-related emergency room and urgent care center visits on days with major risk, the largest proportion of visits occurred on days with moderate heat risk. So there were just over 6 days last year where we had a major risk forecast, and that made up 33% of the total visits for heat-related illness that we saw over just 4% of the season. But we did see over half of visits occur on days where there was just a moderate risk forecast. So we want to underscore it doesn't have to be that hot for heat illness to strike for some groups. Next page, or next slide, please. And we also want to highlight that heat effects are cumulative and that heat builds up in our bodies if we're not able to cool off. And the longer heat goes on, the greater risk of heat-related illness. Last year, 4 out of every 5 heat-related emergency room and urgent care center visits occurred during a heat event where there are 2 or more days of moderate risk, orange risk, or higher. And even when temperatures drop after a multi-day event of high heat, warm weather can still stress the body and cause illness and injury because of compounded cumulative effects. Our bodies have been working to stay cool over that long period. So folks should still be cautious when heat lets up. And for these reasons, there are opportunities to provide different messaging throughout multi-day heat events. Some folks should be more cautious in the middle or at the end of events. If it's the 3rd hot night in a row, messages could focus on finding a cooler place to rest, maybe sleeping in the basement or changing up their workout routine or gardening plans to take it a little bit easier on the 3rd day, 4th day of an event. Next slide, please. So shifting to the WHO, these are some common characteristics that we see in our heat-associated fatalities. There have been 14 deaths associated with heat over the past 3 years. 85% were over the age of 60, 85% were men, 85% were single, widowed, divorced, 79% occurred at the resident's home, 71% had underlying conditions, and 50% had veteran status. And a lot of people know someone who fits this description. This could be folks' neighbors, fathers, clients, buddies, tenants, grandfathers, or patients. And these all make great opportunities for interviews, for authentic voices to share their experiences around how they stay safe in the heat. And we also want to underscore that that point around 79% occurring at the resident's home and highlight that indoor conditions can be as dangerous as outdoor conditions if there isn't reliable air conditioning. So yeah, that's after that slide. We'll go to the next slide, please. And then talking more about other heat sensitive groups, these come from the National Weather Service tool, people ages 50 and over, people using certain health or with certain health conditions or using certain medications, people without reliable AC access, people working in hot environments, young children, those doing strenuous exercise, and folks that aren't acclimated to the heat that is forecast. So these are all groups that should be monitoring conditions and taking action when there's a moderate heat risk 2 or higher forecast. And a lot of people can change in and out of some of these categories depending on their circumstances and may not see themselves as vulnerable to heat. So that's one of the things we're trying to build awareness around is if one of these categories applies to you. Next slide, please. So folks ages 50 and over, 88% of recent heat-associated deaths were over the age of 50. That's over the last 4 years. And we also see this age group overrepresented in emergency room and urgent care heat-related illness visits. We know older adults often underestimate their own risk regarding heat. And so recent research has shown some factors and frames that are motivating for older adults to take action. And this includes finding relief from heat. So getting away from that discomfort of being hot and finding someplace cool and more comfortable to hang out, avoiding UV exposure. So thinking about skin health and getting out of the sun has been motivating. And then knowing that a health condition or medication can put them at risk. So there's a direct physiological line that's altering their heat sensitivity, and it's not just their age. So those are all opportunities to frame action for folks. And again, find an authentic voice to convey those in a more casual way than what we have on the slide and their own lived experience and perspective. Next slide, please. So health conditions and medications. Some health conditions and medications reduce the body's ability to cool off, and there's a lot of variation in how that happens depending on the condition or medication. It can impair thirst, it can impair sweat, it can cause problems maintaining fluids, can affect how our bodies just thermoregulate in general, changing cardiac output. And that's why it's really important for folks to know if a health condition or medication that they're on could influence their heat sensitivity. And doctors are great resources. They can provide advice on heat and health, and know risk factors to look for and actions that somebody should take depending on their specific circumstances. I do want to, and we have a couple of the more common health conditions and medications that affect heat sensitivity on the slide there. And at the end of the slide deck, we've also linked the CDC's webpage on medications and heat interactions. So there's a lot more there. I do want to highlight the chronic kidney disease. We looked at acute kidney failure in emergency room and urgent care visits locally over last summer. And we did see that there was an increase in acute kidney failure on days with major risk compared to days with no risk. There's more information in the brief, but just want to highlight that there are increases in some of these health conditions that we see in the county locally. Next slide, please. Unreliable air conditioning access. Now is a great time to remind people to get a unit and not to wait until the forecast reads moderate, major, or extreme risk next year. People, and we also know that people are worried about running an air conditioner because of the cost. So some messages to encourage action and address these is to call 311 today to check eligibility for air conditioners or utility assistance, and they can be connected with programs and resources that can help out with that. Also to speak to their doctor when they're talking about potential health conditions and medications that may affect their heat sensitivity, to see if their health plan has cooling devices available to them. And that often requires a diagnosis of a health condition that is sensitive to heat. So doctors are the pathway to that resource for them. And then we want to highlight that fans can help folks keep cool. It can be a cheaper option, but we only recommend the use when it's below 90 degrees or Fahrenheit inside. Above that, you're blowing around hot air, and air conditioning is more effective and worth the cost. Next slide, please. So people working in hot environments, we did see an increase in occupational heat-related illness last summer. There are 14% of all visits to the ED or urgent care center were related to an exposure at work. And this is double the number than we saw in the previous summer in 2023. And some common sectors that we see these come from are warehousing and transportation. So thinking delivery truck drivers, they're getting in and out of the vehicle carrying packages in the heat, kitchen staff, both back of house staff and wait staff that are transitioning from hot kitchen environments to maybe a patio that's in the sun and moving back and forth between those two locations, and then construction and landscaping. So again, another opportunity for authentic voices to communicate their own experiences in the heat. Next slide, please. And then we want to remind folks that employers are responsible to provide care for employees when it's hot. When temperature exceeds 80 degrees Fahrenheit, most employers are required to provide access to shade and drinking water. We've linked the OSHA website for more resources on that. And when temperature equals 90 degrees or more, employers must also provide a way for employees to contact their supervisor and monitor for signs of heat illness. So now's the time for employers and employees to plan for hotter days, including thinking about water access, shade access, heat illness symptoms and awareness, and a plan of action for when somebody starts to demonstrate those symptoms. Next slide, please. So a couple of ideas on what folks can do to stay safe and support others in staying safe. We've already talked about how people often don't perceive themselves as being vulnerable to heat. So if you were to give somebody a text or a call, they may say that everything is fine when they may be vulnerable. And so we want to encourage folks that when they check on people, do it in a way that directly supports cooling. So deliver cool water, sports drinks, or electrolytes, and share tips to stay cool. Suggest outings to cooler locations and going and picking them up if they have transportation related barriers, and looking for and naming signs of heat related illness, and thinking strategically about when you're supporting folks. And if there's like a couple days in a row of a forecast of moderate, major, extreme heat, it's as helpful to do it in the middle of those days or towards the end as at the beginning. Next slide, please. And then on where to go, cooling centers are only open on the hottest days, and there's one of many options for where folks can travel to stay cool. So some other locations to suggest are movie theaters, libraries, arcades, pools, folks' favorite store of choice to browse and shop, sit in the shade at a park, or go to a friend or neighbor's house that has air conditioning. And I think this is my last slide here. And so this is just like a recap slide of some of the key messages and takeaways that we've talked through, organized by when, who, and what. So we want to highlight that in addition to major and extreme risk, moderate heat risk, orange can be dangerous for many, and that it can be as dangerous inside as it is outside if folks don't have reliable air conditioning. For who, men ages 50 and up who live alone are the most common demographic that are dying from heat. But there's also a wider range of heat sensitive groups, and it's easy for folks to transition in and out of those groups depending on their circumstances. So while most folks don't think they are vulnerable, they could be, and should know what does makes them sensitive to heat. And that's linked to our kind of final category around what, and our final bullet of stay in an air conditioned indoor location as much as you can and help folks get to those locations.
Hi, folks. I'm Brendan Haggerty. I'm the Healthy Homes and Communities Manager in the Health Department. And I'm going to just highlight a couple of additional summer hazards that we pay attention to during the warm season. The first one is air quality. And there are a couple of ways that air quality commonly deteriorates in our area during the summertime. The first one, of course, is wildfire smoke. We often see that coming in from other parts of the Pacific Northwest or even further. Sometimes that comes in way up high in the atmosphere and it doesn't really have health effects when it's that high up. It just looks hazy. Other times it blows in at ground level. And that's when people who have a respiratory sensitivity really need to start paying attention and take protective measures. The other way that our summertime air quality can deteriorate is ozone, which a lot of people are familiar with the ozone layer. And it's great when ozone is way up high, but it's harmful when it's at ground level. So we often say good up high, bad nearby. Ozone is basically smog, and it's a respiratory irritant. And that can be especially harmful for folks who have conditions like asthma or COPD. Ozone is a pollutant that tends to accumulate through the day and then declines in the evening, in the late evening. So it peaks in the late afternoon or early evening. So it's something that people should pay attention to over the course of the day if they have a respiratory sensitivity or a condition that can be exacerbated by it. And one thing that might mean is like kids with asthma might want to make sure they're playing outside in the morning, but not in the late afternoon, for example. The next slide, I want to just emphasize that the county monitors air quality every day. We have an ordinance that curtails wood burning on days with the worst air pollution. And so on days when the air quality index is getting into that moderate category, we call that a yellow day. And we ask people to voluntarily reduce any wood burning. So think of your backyard fires in the summertime. And on days with the worst air quality, we call that a red day, and wood burning is prohibited on those days. If we have a red day, we will issue a press release. You can also keep up with our advisories on our website, on social media. We have an email subscription you can sign up for, or a text subscription. The next slide, the last thing I'm going to mention here is just water safety. And at this time of year, especially in the early part of the season, our rivers are running fast and high and still very cold with all that snow melt. So we often have issues with safety early in the season. Last year we had 2 drowning deaths, and when we look over the past 7 years, we find that folks who are Hispanic, Latino, Black or African American, men, and younger people have higher drowning fatality rates. And that's pretty consistent with nationwide trends. But the good news is that drowning is preventable. So wearing a life jacket and avoiding intoxicants is always a good idea in the water. And then early in the season, when our waterways are still running so swift and so cold, it's a good idea to use extra caution. And with that, I will pass it to Chris Voss.
Great. Chris Voss, and I am the Director of Emergency Management for Multnomah County. Thank you, Brendan. Thank you, Abe. I have just one slide, and I wanted to highlight something that often the county sort of asks, because there are events sometimes where we recognize that the risk is high enough that the county wants to take additional operational actions. And I'm probably going to start at the bottom and work up on this slide. The most common question I'm often asked is, when is the county going to open cooling centers? And you've heard a lot about, there's a lot of other options every day, but there are some days when we think the risk is so high, specifically when the heat risk reaches magenta, we will automatically open cooling centers in the county to provide additional spaces for people. We also, about half our activations are not levels where we hit magenta, and there are some summers where we don't even hit that level. But a lot of activations also happen when we reach a red heat index. And it's not every day that we reach red. The county looks at a lot of the factors. And so if we see a day where there is a red heat index, we're seeing maybe elevated ED visits, 911 calls, we'll consider what day of the week it is in the county, because we know on Sundays and holidays, sometimes there's less options for some people to find cool spaces. And so you might see us in a situation where we're more likely to open on those days. Even what time and what period of the summer, we know people acclimate to the heat. So we're more likely to probably activate on a red day early in the season than later in the season if we're not seeing other factors. And then our first two thresholds are mostly about how we sort of plan and prepare and notify. There's also a communication aspect too, where we're starting to get out there and before each event or even in the minor events to sort of we increase the outreach that we're doing to communities that are sort of higher risk. So that's it. Next slide.
Let me turn my camera on. So we wanted to talk a little bit about communications, and when we are activated, we aim to provide at least a 1 day heads up when cooling centers are going to open. And so that will look like a press release going out to the media, and that we aim to get that out around 11 a.m. And then we also will put an update on our website, Help for When It's Hot. And then when we are activated, we try to arrange daily media availabilities with experts at our cooling centers, and we try to give a heads up, and we try to get that before noon so we're able to meet TV's deadlines. And then we also are meeting with the medical examiner's office daily at 3 p.m. when we're activated to see if there have been any heat-related or cold-related in the winter deaths, suspected deaths. And then if there has been a weather-related suspected death, we will put out a press release where we will provide the date of the death, the age, the sex, and the zip code of people who are suspected to have died from weather-related causes when activated. And so we get a lot of questions on, have there been any deaths when we are activated? And so we will let you all know when there has been a death when we're activated. Don't worry. And just know we are meeting with the medical examiner's office daily to get those updates as soon as possible. How media partners can help. One thing we're trying this summer is really to reach that older adult population and making sure they're getting to places to cool off. And if we're not able to reach those populations that Abe mentioned earlier, try to help us reach their family and friends about ways they can offer support that's tangible, going over, bringing a water or a Gatorade, getting them to go to the library for a couple hours to cool off. We also want to raise awareness that it's housed individuals who are dying predominantly from heat. And I think that is often not always understood by the public. And so raising that awareness that it's people who are in their houses who are dying from heat. Doesn't have to be that hot to experience heat-related illnesses, as Abe was showing that it's really when we're in that orange zone and higher of the heat index that we're seeing people getting sick. We think it'd be great if we could see people using the heat risk tool as part of your weather reporting. You can put it up. You can find it on the National Weather Service. They have a map of the Portland metro area and it shows which colors each part of the area is in. And you can direct folks to help for when it's hot. That's at multco.us/hot. And that's a great resource even for people to go to today if they have questions on what do signs and symptoms of heat illness look like. Where can I get an air conditioner? How do I stay safe when we're swimming in natural bodies of water? So it's a great resource. And then again, that's where we'll be putting updates when we are activated. Here's some resources. We'll be sending this out afterwards on where people can find information about the weather and whether or not shelters are open. Here's some links to the CDC on heat illness prevention. And then we will also be sending out a link to our 2024 seasonal heat hazard brief, which was published this week. And that sort of, Abe gave a summary. The data we were talking about today is mentioned in this brief. So I'm going to end the screen share and we will open it up for questions. If you want to just raise your hand feature and say your outlet, and then we can help direct your question. Well, if we have no questions today, you all are a quiet bunch. We can conclude the meeting, and I again will be sending out a copy of the slide deck and a link to the seasonal weather brief, which can be found on our website. And I know it's not that hot right now, but we know it will be getting hot this summer. And so we appreciate all of our partners in the media for helping us keep people safe this summer, making sure people know where to go to cool off. We are all partners in this, and we appreciate the work that you all do. With that, we will conclude the meeting. Thank you all.
Hey, I do have a question.
Okay,
I did not know how to raise my hand here. I'm
that's
not
okay.
seeing the little icon. I'm Antonio Sanchez. I'm with Noticias NW, the only Spanish language digital newscast in the region. And I was also questioning the governor because my viewers have been questioning about more culturally specific efforts to prevent dying from heat waves. We don't see very many campaigns in Spanish or other languages, and I think that's where we as media can help the county and the state to warn people about these things if it's reaching this information in their language. So I don't know exactly how much investment the county is doing in trying to reach these vulnerable populations. And if so, can you please let me know because I don't know much about Spanish resources that are out there by the promoted by the county. Thank you.
Yeah, So we are translating a lot of, if not all of the messages that we're putting out on social media into Spanish and other languages that are commonly spoken in the county. We also have a Spanish speaking spokesperson she's lovely. She would be happy to do interviews with you. She also does videos that we put out. I know she's done a series around drowning in Spanish. And so, yes, we hear you and we want to reach out to the Spanish speaking community. And that's great to know that you are a resource. I don't know, team Multnomah County folks, if we have anything to add. Brendan, I see you're coming on camera.
Yeah. Well, I'll just add that, over the past year, we've worked with community health workers who are folks who are, embedded in the community who help folks navigate health supportive resources. Um, and we've done trainings with those folks on climate resilience topics, including extreme heat resilience. And one of our partners in that work has been the Latino Network. So we have materials available in Spanish, and we're working with groups who work directly with that community.
Antonio, I'm happy to help connect you with our Spanish speaking spokesperson. Her name is Alicia Mendez. So you two can sort of have a chat maybe about ways you think you could see the county communicating better to reach the Spanish speaking community.
Thank you. Yeah, it used to be with Dr. Vines, but ever since she left, we were left without communication in Spanish. So I think that's a very good option that you guys are offering. If you have somebody in Spanish, that'd be great.
Great. Any other questions? Not. Again, thank you all. We will be following up. If you have any questions, you can always reach out to pressoffice@mulco.us and we will be happy to respond via that email address or setting up interviews as needed. Thanks all.